Christine Ihrig is doing what she loves most, spending time with her horse Tiffany, which to Christine is heaven on earth. But while she's living the life she's always dreamed of, not long ago she lost her husband to a heart attack, and then her own heart started aching.
And it was hurting right here, and I'm thinking, I've got a broken heart. And my friend came and she said, Christine, there's something wrong with you. I said, I've got a broken heart. And she said, but you don't look good, you're holding your chest. And I said, well, it hurts. And they said, please let us take you to the doctor.
Christine was taken to the emergency room at Westside Regional Medical Center, where she was treated by Dr. Frederick Shaliff.
We saw her, we did EKGs, blood work, and at that time it looks like she appeared to have a significant heart attack. We brought her emergently to the cardiac cath lab and did a cardiac catheterization and an acute intervention. Cardiac catheterization is also known as an angiogram, is a test where we insert a small little tube through the artery in your leg up to the heart, inject iodine, and then take pictures. It's called fluoroscopy, like an X-ray. At that time, we can assess the patient and see if they have any blockages. And if they have blockages, we treat them usually with a balloon or a stent.
Unfortunately, due to a blocked artery, Christine's heart muscle had been starved for blood for so long that she was barely alive.
But her heart muscle function was very weak. In fact, it was so weak, she was barely able to sustain a blood pressure.
I do remember very clearly when they were putting the balloon in that I saw very, very clearly two roads, and they were right next to one another. And my husband was standing at the end of one road. And I really, really wanted to go down that road. But in the road on the right, my daughters were there. And I thought, I can't leave them. So I made a conscious decision at that moment that I'm going to live. And here I am.
She was quite close to death, and without the balloon pump and acute intervention, she would not have survived.
In the medical world, it's called STEMI times, the time from which the heart artery first closes to the time when it's opened again, typically with the use of a catheter. Westside Regional Medical Center is committed to keeping STEMI times low.
The staff at Westside is exceptional. The personnel in the cardiac cath lab are excellent. They're very attentive to the patients, and they're extremely knowledgeable in their jobs. They work as a team very cohesively, and it makes for much better patient care.
Of course, patients can do their part in lowering STEMI times by being aware of the symptoms of a heart attack.
The signs and the symptoms are chest pain, shortness of breath, or a chest pressure-like sensation. Some females or males may get indigestion-like symptoms. Sometimes the pain can radiate to the jaw, they can radiate to the shoulder, back, arm. It depends a little bit on where exactly the obstruction is.
Aside from knowing the signs of a heart attack, it's just as important to know how to prevent one in the first place.
We would exercise more, control our diet, stop smoking, and try to really take control of all those things that can affect our risk factors for coronary artery disease.
As for Christine, she's been given a second chance at life and is most appreciative of the people who made it happen.
If it hadn't been, truly hadn't been, for the staff at Westside Regional and their excellent care, I would not be here today. I appreciate it every day of my life, and I think about them a lot, and I miss them. They became friends. They just weren't my caretakers, they were my friends. And I go back and visit them, and I'm just happy that that was the hospital that I went to.
Reporting on the Faces of HCA for the Healthcare News Network, I'm Biffar.